Macon County, Alabama, 1932. Herman Shaw is 30 years old. He was valedictorian of his high school class. He wanted to study engineering. Instead, he farms cotton. And when a government flyer at his church promises free medical care for men with bad blood, he walks to the nearest clinic. The doctors examine him. They draw his blood. They give him a free meal and tell him to come back every year. They do not tell him what is in his blood. They do not tell him the name of what he has. When a cure arrives 13 years later, they do not give it to him. He will return to that clinic for 40 years. This is his case file. The clinic is on the campus of the Tuskegee Institute in central Alabama, a college established in 1881 for the education of African Americans. But the doctors running this study are not from Tuskegee. They are officers of the United States Public Health Service. In 1932, the Public Health Service launches what it calls a study of untreated syphilis. Syphilis, a sexually transmitted infection caused by the bacterium Treponema pallidum, progresses through stages. In its final phase, it can destroy the heart, the brain, and the bones. But the late stages take years to reach, and between them, the symptoms can disappear entirely. A man can carry the disease and feel nothing. 600 men are enrolled, 399 with latent syphilis, 201 without. The study is designed to observe the disease exclusively in African American men, based on an unproven assumption that syphilis progresses differently according to race. The men are sharecroppers and farmhands. Most have never seen a doctor. What they are told is that they have bad blood and that the government will treat them. The government does not intend to treat them. The study is designed by Dr. Taliaferro Clark, head of the Public Health Service Venereal Disease Division, and directed on site by Dr. Raymond Vonderlehr. Their objective: recruit men with untreated syphilis, monitor the progression of the disease, and follow them to autopsy. To keep the men returning, the Public Health Service offers free examinations, hot meals, and burial insurance. $50. Enough for a casket and a grave. The autopsy is part of the arrangement. It is the cost of the burial benefit. The men's primary contact is not a physician. It is Nurse Eunice Rivers, one of only 470 black public health nurses in the entire country. Rivers drives the men to their appointments, distributes aspirin and mineral supplements, and maintains their trust across decades. The extent of what she understands about the study's true design remains historically debated, but for the participants, she is the face of the program. In 1933, Vonderlehr needs the men to submit to lumbar punctures, spinal taps to test for neurosyphilis, the disease's penetration of the nervous system. He knows the men may refuse if they understand the procedure is diagnostic, not therapeutic. His solution is a letter sent to every participant. Its final line reads, "Remember, this is your last chance for special free treatment." The spinal tap is not treatment. The letter is a deception printed on government stationery. Privately, Vonderlehr writes to his colleagues that the details of the procedure should be kept from the men as much as possible. The first clinical data is published in 1934. The first major report appears in 1936. Over the next 4 decades, at least 13 articles will be published in medical journals, read by physicians across the country. The men are described in some reports as volunteers. No physician who reads these papers raises an objection. In 1941, some 250 men from the study register for the draft. At military induction centers, they are diagnosed with syphilis. Military doctors order treatment before the men can serve. The Public Health Service intervenes. Vonderlehr writes to the Macon County health officer Dr. Murray Smith, requesting that the men be exempted from service and from the treatment that would come with it. They are kept from the draft. Their one institutional path to a cure is closed by a different arm of the same government that enrolled them. Von der Leer retires in 1943. Dr. John R. Heller takes over the venereal disease division. That same year, penicillin is confirmed as a reliable cure for syphilis. Heller does not offer it to the men. By 1947, penicillin is the standard treatment nationwide. The government opens rapid treatment centers, public clinics where anyone can receive the drug. When these centers reach Macon County, Public Health Service researchers ensure that the study participants do not attend them. Year after year, Herman Shaw returns to the Tuskegee clinic. He receives his examination. He receives his meal. He does not know the name of what he carries, or that a drug exists that could end it in days. The study is not classified. It is not concealed. It runs on federal money, uses federal employees, and publishes in the open medical literature. The men grow older. Some lose their vision. Some lose the ability to walk. The data is recorded. The study continues. The question the study raises is not why it started. It is why no one stopped it. The Tuskegee study did not survive for 40 years because of a single decision. It survived because of a sequence of decisions, each made by a different person, each choosing continuation over scrutiny. The study's premise was built on racial pseudoscience. The belief that syphilis behaved differently in the bodies of black patients, producing more cardiovascular damage and less neurological involvement than in white patients. This hypothesis was never validated. It was inherited from a tradition of medical thought that assumed biological differences between races, and no one inside the program questioned it. The men were recruited from one of the poorest counties in the country during the worst economic collapse in American history. They had no access to private health care. They had no reason to doubt a government institution offering free care. The distance between a federal physician and an Alabama sharecropper was not merely professional. It was structural. Informed consent, in any meaningful form, did not exist within this arrangement. When von der Leer retired, Heller continued. When Heller moved on, his successors continued. Each new director inherited the study as an ongoing program with published results, institutional momentum, and federal funding. Ending it would have required someone to declare that the work and the careers built on it had been wrong from the start. In 1966, a young public health service epidemiologist named Peter Buxton learned of the study from a colleague in San Francisco. Peter Buxton, born in Prague in 1937, the son of a Jewish father, had fled Nazi-occupied Czechoslovakia with his family as an infant. He drew an explicit parallel between the Tuskegee study and the medical experiments conducted on concentration camp prisoners. He filed a formal complaint with the Public Health Service. It was rejected. He filed again in 1968. A CDC committee reviewed the study. It voted to continue. The study was not a secret kept by a few. It was a consensus maintained by many. 13 papers, 4 decades of federal oversight, and at every level of the system, silence. In 1972, he gave his documents to the Associated Press. Reporter John Heller published the story on July 25th. The following day, it appeared on the front page of the New York Times. The study was terminated within months. By the time the study ended, only 74 of the original participants with syphilis were still alive. 28 had died directly of syphilis. 100 had died of related complications. 40 of the men's wives had been infected. 19 children had been born with congenital syphilis, a form of the disease passed from mother to child during pregnancy. No individual involved in the study was ever criminally charged. In 1973, Senator Edward Kennedy convened congressional hearings. Attorney Fred Gray, the same lawyer who had represented Rosa Parks, filed a class-action lawsuit on behalf of the participants and their families. In 1974, a $10 million out-of-court settlement was reached. That same year, Congress passed the National Research Act. The Belmont Report, published in 1979, established 3 principles: respect for persons, beneficence, and justice, that now govern all federally funded research involving human subjects. Institutional review boards became mandatory. On May 16, 1997, 8 surviving participants were invited to the White House. 5 attended in person. Herman Shaw, 94 years old, was helped to the podium. He spoke on behalf of every man who had entered that clinic and never been told the truth. The president called the study wrong. He called it racist. Shaw died 2 years later. The last surviving participant, Ernest Hendon, died in January 2004 at the age of 96. The Tuskegee study ran for 40 years, through 5 presidential administrations, through the discovery of a cure, through a world war, and through 13 published medical papers. At every point, someone in the system chose to look at the data and continue. The men were never asked. One question for the comments: how many decision points does it take before silence becomes policy? The next case on this channel is the oldest surgery in human history, and the patients survived. This is the sealed ward.